Hi, my name is Rahel, and this is my video reflection of my clinical experience in the OB triage unit. And I'll be answering all the 6 questions that was provided in the PDF. Starting with the first question, important initial questions to ask a patient as soon as they get admitted into the triage. The things that I noticed that they asked were, what brought you in today, your gestation, the patient's gestational age, and an estimation of their due date, fetal movement, contractions, bleeding, intensity and frequency of the contractions, and the amount of bleeding, I would say, as well as any leakage of fluid. It could be their water breaking, or the rupture of the membrane, if there's pain level and where is it at, and past pregnancy complications, as well as pre-existing issues or diseases like preeclampsia, hypertension, diabetes, or gestational diabetes, or diabetes like you had it before and then now you just developed it during pregnancy. And these questions are very, very important because in OB, this is a very like an ER. It's very high paced, and so asking these types of questions in a very clear manner determines how to help the mother, as well as maintaining the fetal well-being and also the mother, and prioritizing care, really. The second question, example of clear communication. And okay, so one example of clear communication that I saw in my triage unit was when a patient came in with decreased fetal heart rate. The nurses shared all the important details with the provider. The provider at that floor was a nurse practitioner, using very short and clear statements and repeated tasks using closed loop communication, and everyone worked together like calmly and stimulously, like they're like kind of like robots in a sense, in a good way, of course. And they were talking to each other loudly so everyone knows what they're doing. And this actually provided the patient a very stressless environment because it showed them that they know what they're doing and they're gonna get help to whatever the conditions that they have. And this is also good for the nurses and the provider because they're gonna address the patient's issue right away. The second one is how the triage nurses supports flow and safety. I saw how triage nurses keep the unit running safe, really, because they're the first ones that probably see the patients, really, and then they just get admitted to the specific floor that they need to go on. So they do rapid assessments like we talked about, decide which patients need immediate attention, start fetal monitoring, communicating with the providers, other nurses, and educating the patients on their condition or what they're doing, really, and their ability to manage multiple patients while staying organized mentally and in their movements, I guess, is what keeps the unit flowing smoothly and safely, especially during just a high stress environment and very quick thinking. The fourth question is what I want to learn more about. For me, what I really want to learn more about right now is fetal heart rate strips, because I noticed that, I don't know why, as soon as I saw it, I was like, this is hard. It's like EKGs, but for babies, and knowing the contractions. And the contractions part, I feel like that part of the strips, they're not so bad. They're really not that bad. When it comes to the fetal heart rate, because there's more to it, learning about the decelerations, really. The others are not that bad, just the decelerations part. That one just throws me off, especially the variability one, because like for the early and late decelerations, for those, like, I have grasped it and I know what it looks like, and variable decelerations, but the variability, like knowing which is minimal, which is moderate and which is marked. I'm like, for marked, okay, but the minimal and the moderate, sometimes you just overlap for me. And so I feel like I need more practice with that to build my confidence, so that maybe one day I can work in a triage. And then for the fifth question, speaking to a patient who learned their baby has no heartbeat. Okay, I'm so sorry. I know this is an incredibly painful, and I want you to know you're not alone. When you're ready, we can talk about your options for delivery and any preferences you have when it comes to, cultural or religious or any personal ones that you want us to honor. There is no right or wrong decisions. Whatever feels best for you in this situation, when you're ready, please let us know. I'm here to support you as well as the other nurses and every step of the way, and the doctors as well. And if you need a moment or have questions, that's completely okay. And when you need us, please call this call button. And yeah, I think that's how I would talk to the patient. Okay, the last question is educating a patient about preeclampsia. Preeclampsia. Okay. So the symptoms you're having is headaches, visual disturbances, or vision changes, and swelling. It can be signs of a condition called preeclampsia. This preeclampsia is related to high blood pressure. Here in the triage, we will check your blood pressure very frequently because it's related to high blood pressure. We will also run labs and monitor your baby as well because it can affect the baby. And the labs are just to assess how your organs are because of the high blood pressure. And since this is an abnormal state for your body, it can have an effect. And if we do the labs frequently, see your baby movement, check your blood pressure, we can make sure that we address any high risk situations right away. And sometimes we give medications to lower your high blood pressure or prevent seizures, like magnesium sulfate. And you did the right thing coming in as fast as possible, and we will keep you and your baby safe, and we'll keep monitoring and also educate you on every step of the way, and whatever we're doing. And okay, and yeah, and so to basically sum it up, this OB triage experience taught me a lot about communication, rapid assessment, rapid assessments, and how nurses help prioritize patient safety, really. And then I'm grateful for what I have learned and what I'm able to experience in this triage unit. And I really do look forward to one day working there, but I know that I know in Summerlin, I was asking one of my nurses, and they were saying that you need at least 3 years of experience in L&D or postpartum, or one of those, to basically even apply to a triage unit. And I could see why, and I really truly understand them. Those nurses know so much, and their ability to be with their thinking. I literally could see their quick thinking, through their movements. They're like this, that, and it's just amazing. And I hope that one day I could do that. And yeah, that's my video.